We have people joining in, so we can wait for 30 seconds and then we can start. We are live for everyone.
Great.
Can I get to see the name of the attendees list? I don't, I can see their numbers, but I can't see their list. I want to see all who are joining the program. Is this possible?
Dr. Srivastava, when you click on the participants list, a tab will open up for you and you can click on the attendees option and it will give you the name of all the attendees there.
No, what I'm saying that it's showing two parts, panelists and attendees. When I click on panelists, I can see the name, but when I click on attendees, I can't see the name. That's what I'm saying.
I can see the names.
Yeah, even I can see the names.
Can you see the names?
Yes.
Yeah, let me just make him a co-host, so maybe.
Yeah.
Okay.
So please confirm if you are able to see now. We have made you co-host.
No. Yeah, I can see from my mobile phone login. Okay, so good enough. That served my purpose. Okay, now, welcome everyone to the NPCCHH webinar series, and we will have today. One sec. There's so many disturbances. Just one sec. Okay. Okay, so once again, welcome everyone. This is the NPCCHH webinar series, and we'll be talking today about some of the interesting work that has been done by CEEW Council. And CEEW is a very important organization in the country which has previously worked in full form. It's called the Council on Energy, Environment and Water. And as the name suggests, it's an important organization that works in area of energy, environment and water. And all of that is important for the program that we work in, the National Program on Climate Change and Human Health. And we have two interesting speakers today who are joining with us today, and they will be talking about the work that they have done at CEEW on evaluating climate risk and working on climate vulnerability index. They came out with two reports, one in December 2020 and then another in October 2021. These two reports, the first one was about mapping hotspots and responses mechanisms in context of climate change vulnerability. And then a follow-up report came out in October 2021 about mapping Indian climate vulnerability, the district level assessment report. And these reports have addressed issues of climate vulnerability index If we all remember, some time back, we had the Indian Meteorological Department presenting us with the work that they have done by organizing a website where we could see district level assessment of vulnerability of various extreme events that this country faces. And this is another work that has been done. And let me first introduce you to the speakers that we have today. We have Avinash Mohanty today with us. He leads the climate risk work at the council. His work primarily involves designing decision-making toolkits for effective policy making around the intricacies of climate change risk, sustainability, and environmental resources management. His research is focused on evidence-based policy research on climate change risks and impacts, water management, climate change financing, and in managing projects. He is also a reviewer of the IPCC 6th Assessment Report on Impact, Adaptation, and Vulnerability. And then the other speaker today is Shreya Vadhavan, and she is a research analyst with the Risk and Adaptation team. At CEEW. Her work is focused at extreme events, spatio-temporal analysis that helps in designing decision-making tools. This includes intersecting science, policy, and practice to mainstream climate action. She holds a master's degree in environment management from Guru Gobind Singh Indraprasth University, Delhi. And both of them, as you can see there on the screen. And with this, we welcome both of them, and I request both of them to take forward and talk to the state and district program officers who we have today in this seminar. And they are joining from all states and across the country. And their work includes working on climate change and disaster, in understanding the climate vulnerability, and also making necessary efforts to strengthen the health system response against this climate vulnerability. So with that, over to you, Avinash and Shreya.
Shreya, you need to unmute yourself here.
I hope I'm audible.
Perfect, loud and clear.
Yeah. Thank you, Dr. Srivastava, for organizing today's session on building health sector resilience. So before we dive deeper, let me set the context for this session for all of you today. A pandemic-driven prolonged closure and a gradual but uncertain opening post the third wave reiterates the dire need to build health sector resilience. Our findings suggest that 75% of the Indian districts are extreme event hotspots, and many of the districts that you are representing today are either on the brink of or are already facing the impacts of extreme events. Climate change not only has direct impacts on human health, but also threatens the capacity of health systems to manage and protect community health, for example, through vulnerability and reliability of infrastructures or other critical services. Health systems should therefore be increasingly strengthened so that they can continue to be effective and responsive to improve community health in an unstable and changing climate. CEEW's Climate Vulnerability Index will help you to map these critical vulnerabilities, plan efficiently and better in case of an extreme event, and adapt to the changing climate by insulating the communities from any disgraceful emergencies, thereby avoiding preventable climate change-related health issues. A climate vulnerability index can be a key instrument to identify and prepare for changing health risks. Further, it can provide information to practitioners like you all on the extent and magnitude of the likely health risks attributable to climate change, as well as it will help suggest hyperlocal actions that can prevent or reduce the severity of such future impacts. The National Adaptation Plan also enumerates the importance of the climate proofing of health infrastructure and the health sector. So together, let's try to build a resilient and responsive health sector. Now, I would like to hand it over to Abhinash to help us better understand and decode the Climate Vulnerability Index for building health sector resilience.
I hope my screen is visible, right?
Yes.
Perfect. Thank you, Dr. Srivastava, for organizing this, for having such lovely interactions with us, and appreciating our work on climate vulnerability and mapping the climate risk at a granular level. So good evening to one and all who have made it to this spatial training session or webinar. First of all, let me introduce what exactly CEEW is and CEEW does. So CEEW is Asia's leading policy research think tank, and Asia's not for one of the major policy research institutes, and it works around 7 thematic areas, and it has a dedicated center for energy finance. While the council uses data integrated analysis and strategic outreach to explain and change the use, reuse, and misuse of resources, we use strategic communication to lead our work. So this is what we do. And the work that I'm going to present is primarily under the purview of risk and adaptation. But now we are mapping the Climate Vulnerability Index, and in 2021, but CEEW's thought leadership started way back in 2015, when we did a global assessment, and this global assessment was released strategically in the London Stock Exchange as well as in the Bombay Stock Exchange. And further, we deep dive, and in 2019, we started developing our climate risk catalyst work by, in terms of releasing the first report that Dr. Srivastava, meanwhile, had just highlighted about preparing the India extreme events, as well as mapping the hotspots. And that is what actually Shreya made the numbers purviewed from that study itself. While we are striving very hard, it gives me immense pleasure to discuss about the Climate Vulnerability Index, because health is one of the important sectors where a lot of resilience need to be brought in. But why do we need to discuss climate vulnerability, or why do we need even to have climate risk assessments? It is because this infographics says it all. 75% of the Indian districts are extreme climate event hotspots. More than 40% of these districts are showcasing a swapping trade. That is, traditionally flood-prone areas are becoming drought-prone and vice versa. But what we have also been done, these extreme events have done so far, is more than 76.34 billion USD has been lost in terms of 390 plus extreme events. Then, if we compare, because we did a penta-decadal analysis right from 1970, and if we compare the number of events, then 310 events have been witnessed just post 2005. Now, why does this number speak of volume? While these numbers are grim reminders, and 2 days from now, IPCC is also going to release its second tranche of the report, what does the health sector professionals like you need to do with these numbers? Here is why. Because we are almost into the flag end of the second year when the pandemic had hit us. And this pandemic is the worst pandemic of our times. It has transitioned our lifestyles, which has now been defined as mask. Many of us who live in Delhi, of course, we were prone to mask, but because of other reason. But now our lifestyles have been mandated by, mask mandated. Lockdowns, social distancing, we ask ourselves how and when will the pandemic end? While we stand in terms of as a sector, the health sector stands as 179th globally in terms of out of 189 countries when it comes to prioritization of health in its government budget. We know limited budget health needs a lot of support, and left with little fiscal room for kind of powering the primary healthcare centers, especially in rural India. From hospital beds to oxygen cylinders, the struggle cost us many lives. But to be prepared for the future, we must build a resilient healthcare system. We can build a system that doesn't crumble with a pandemic, ensuring health access to all by taking concrete steps like investing 2/3 or more government's health spending on public expenditure. As proposed in the National health policy, it is time to look at solutions that will promise results, drawing focus on preventive care, investing in precision health, and raising the bar for primary healthcare centers, scaling programs to address the threats posed by climate change. And this is why these numbers are important, and we need to collaboratively discuss how the climate vulnerability index can be integrated into your work, into your plans, into your decision-making, and more importantly, into the service that you are rendering, the very important service of making India climate-proofed through the health sector critical emergencies. This is what the function that guides our research, the vulnerability function. Exposure. If you're walking on a road, then you are prone to an accident. If it's a bumpy road, then you are more prone to accident. That is what exposure tells you. In terms of how are you built up? If I am a weak person or a sturdy person, then that will tell me if a auto rickshaw hits me, whether I'm going to get a lot of stitches from Dr. Srivastava's clinic or by anyone else. And that's what defines the sensitivity. Similarly, our ecosystems, our geographies also are sensitive. So it is important to map the sensitivity of that part. And similarly, while a pandemic is there, and many of you who have been dealing with extreme events and pandemics, you know how the hospitals and our healthcare systems are overwhelmed. So what has to be done is to understand what kind of capacity do we have. This is what is the adaptive capacity we try to map. This defines it all. Now, while we were developing the climate vulnerability index, it is important to understand that there should be an integrated vulnerability assessment framework, which is based on a detailed granular exposure assessment, followed by a sensitivity assessment of the landscape indicators, and then adaptive capacity, which maps how much of coping mechanisms do we have and how can we build back better and move forward in terms of building that resilience. This is what India looks like. The map says it all. 5 out of 20 Indians are living in extremely or highly vulnerable zones, which are kind of exposed to all the 3 extreme events. And this is where we need to say it all. If I have to put down the numbers, because we deal with a lot of data and integrated analysis, then 50% of districts in each zone, and India is divided into 6 primary zones. So 50% of the districts in each zone is vulnerable to extreme hydromet disasters. More than 80% of the Indian population are highly vulnerable districts, and eastern and western coast belts of India are extremely vulnerable to all the 3 events, that is cyclone, flood, and droughts, and none of the zones in India have got a high adaptive capacity, whereas just eastern zone is in the brink of having a moderate capacity. Then in terms of sensitivity, 45% of the hotspot districts have undergone rapid land use land cover change, and 32% of the districts, while all of these are increasing, the exposure is increasing, the sensitivity is increasing, what is not increasing is our adaptive capacity. It is somewhat stagnant, and only 32% of the districts have an updated district disaster management plan since 2019. Based on this integrated framework that I just spoke about, we developed the Climate Vulnerability Index. And what we found was 27 out of 35 states and union territories are vulnerable to extreme events. And some of the hotspot districts we have already highlighted in the map. But what is more important to understand here is that while there is a cyclone or while there is a flood, all of these districts has got rural hospitals or kind of urban hospitals or the healthcare facilities. Now, a healthcare facility cannot be closed in an event of a cyclone or a flood. It is not a school. It's a facility which endures our critical services. So the map, if you are seeing now in your screen, please see how much vulnerable are you to the hydromet disasters. What does a climate vulnerability index does? In general, a climate vulnerability index will help us to map better, map critical vulnerabilities to manage the risk, population, geographies, sectors, and key sectors, key elements at risk. In terms of health sector, what are our assets that are exposed to and are at risk? Similarly, it will also help us to plan better, reprioritize policies, plans, and actions to avoid the loss and damage. Imagine last year when there was flooding season, I was being told, and I saw a few pictures in the social media, that the one of the state capitals' major hospital was actually flooded. I mean, 2 floors of that hospital was flooded. That's awful. We can't have our hospitals built which cannot resist a flood, which cannot resist the storm surge, or which cannot resist some sort of water inundation. So clearly, we need to plan better. And then we also need to adapt. Why we need to adapt? Because we are the first responders. We need to provide that response to in terms of an extreme event. So it is very important to climate proof our livelihood options. Resilient landscape planning has to be done so that we can adapt better. And then, of course, the financing is what is at the core of all of this. But how does a climate vulnerability index will help you in terms of building that health sector resilience? First and foremost, what it has to do is we have tried aligning it with these pillars of or the mandates that a health sector resilience should have. And that is what we have tried to map. So what has to be done is CVI will help you to strengthen the capacity of health system to reduce illness, disease due to variability in climate. You can map it better. Improved, how can you do it actually? You can actually improve the disease surveillance, mapping vector-borne diseases, zoonotic diseases, waterborne, transmissible and non-transmissible diseases. Then comes to develop partnerships and create synchrony and synergy with other missions and ensure health is adequately represented in the climate change agenda in our country. And that is where the climate proofing of health sector needs to be done more precisely to strengthen health sector preparedness and response by performing situational analysis at a national, state, district, and below district levels as well. And that is why integrating a climate vulnerability index and integrating climate-related hazards for better disaster preparedness in case of an event is more important. And that's why it is very important to integrate CVI while you are planning even the minute detail of your action plans. Then comes to strengthen research capacity to fill the evidence gap on climate change impact on human health. And I'm not an expert on human health side, so I would refrain myself from giving any kind of information on that. I would love to learn more from what exactly are vector-borne weather-related diseases. And let me assure you from the climate side that all of these diseases are going to increase. And while they are increasing, please ask yourself whether the infrastructure where you are working on are capable enough to cope some of these events. Can they kind of attain to the influx of the diseases rate that is going to increase because of the changing climate? And that's where we need to create awareness among general population, vulnerable community, healthcare providers, policymakers regarding impact of climate change and human health. And let me congratulate NCDC on this part, because I have been discussing with them, and CEEW has been discussing with NCDC, and NCDC is preparing the National Action Plan, National Adaptation Plan on climate change and human health. So that is going to be a kind of torchbearer in terms of developing that framework. And this is where it can be integrated. The Climate Vulnerability Index can be integrated for building community awareness. So that's all I have with the presentation side. I'm looking forward to learning more and exploring how the Climate Vulnerability Index can actually be integrated into some of your plans, decisions, and into some of the work flows that you have been doing of late.
Okay, so is there anything else that you would be presenting?
Sorry?
Is that what your presentation is?
Yes, yes.
Okay. I would have loved if it is possible for you to present the annexures that you had and that templates of,
Of the report?
tables and the maps of the vulnerability that you have in your report, so that a glimpse of what is possible to see in the reports that you have created, and also let them know where can they access these reports.
Yeah. So Shravan and Shreya, I would request you if you can share the link to the report. In the chat box, you will be finding link to the report, so you can always find it. And in the meantime, if you can share the annexure of the report, which has list of all the districts, that would be helpful as well. But do you want, Dr. Srivastava, do you want, in the meantime, let me just share.
I mean, like, for example, on your second report that you have, or district level assessment,
Yeah.
On page 48 and 49, you show the overall vulnerability index of all the states tabled with different color patterns. And similarly, I think in the annexure on the page 1, you show them, I mean, like, for them to get a glimpse of how these have been tabled, so that the district officers will be able to access these reports to get a perspective of their own district.
Great. Shreya, will you be able to share the annexures? Yeah.
So if the state is interested in knowing there, they can see the table on page 48. The districts, if they can look down to the page 61 onwards and get to know what is the status of their own district. How do they rank on vulnerability, on the index, on exposure sensitivity and capacity, adaptive capacity? Yeah, so that's it. This is district wise, and I think that's the annexure report. I can just scroll it through. Okay. So this is district wise on the 3 events of drought, flood, and cyclone. And maybe if possible after this, you could give them an access to page 48 of that report that gives an overall understanding for the state's ranking. Yeah, page 48. Yeah, that's the ranking of all states ranked on Hydromet Disasters Vulnerability Index, with Assam as the most vulnerable. And then slowly the vulnerability index starts decreasing from red towards green. So this is what helps you to know the perspective. Thank you. Okay, thank you, Avinash, and thank you, Shreya, for giving this presentation. A brief address to my program officers. So as you saw today, and the second or the third slide, they provided a snapshot of the reports that they have prepared. This is one of those reports. Okay, I don't know.
I'll do that for you, Dr. Srivastava.
Yeah, so this is one of the reports that they had, and then this is the another report, and these reports are available on the internet, and they will provide you a link to those reports. The purpose of giving you access to the report is that each of you can have an access to understand the vulnerability of your own state and your own districts, making use of the report and understand as how that has been derived. Very honestly, this is what we've been talking to all the states about, doing a vulnerability assessment, but vulnerability assessment can be done for various risk factors of climate change. We had a seminar one day about how agricultural vulnerability has impacted malnutrition, and we all heard the scientists explaining about the work that they had done. So, and this is about vulnerability of climate change in context of disaster. So that's how the principle is the same. You need to know the exposure, the sensitivity, and the adaptive capacity factors that are going to be brought into construction of this index. And these three group of factors together tell you about the vulnerability index. And if, depending upon whether you are talking about disasters or agriculture or vector-borne disease, your factors will change. But the principle and the formulation of how they approach वो सेम रहेगा. तो आपने देखा कि इन्होंने पहला रिपोर्ट जो बनाया और जो दूसरा रिपोर्ट बनाया, उसमें इन्होंने एक चीज समझाई कि जो क्लाइमेट रिस्क इंडेक्स है वो डिस्ट्रिक्ट लेवल असेसमेंट तक करने से हर कंट्री को जियो स्पेशियल तरीके से आप ये पहचान सकते हैं कि कहाँ पे हैजार्ड दूसरी जगह के मुकाबले ज्यादा या कम है, और आपके लिए कौन सा हैजार्ड ज्यादा या कम मायने रखता है. और ये भी इंडेक्स, वल्नरेबिलिटी इंडेक्स में आपको ये समझ आता है कि सवाल सिर्फ आपके एक्सपोजर का नहीं है, सवाल आपकी सेंसिटिविटी का भी है और आपके अडेप्टिव कैपेसिटी का भी है. तो ये कोई आवश्यक नहीं कि अगर आपको क्लाइमेट का हैजार्ड का जो एक्सपोजर है वही अगर सिर्फ ज्यादा मिल रहा है तो सारी समस्या आप ही के यहाँ पे है. अगर आपके यहाँ पे सेंसिटिविटी फैक्टर्स की जो सिचुएशन है और अडेप्टिव कैपेसिटी की जो सिचुएशन है वो अगर अपनी जगह पे हो तो हो सकता है आपकी सिचुएशन ओवरऑल उतनी बुरी ना हो. बहुत एक इम्पॉर्टेंट बात जो उनकी स्लाइड प्रेजेंटेशन में आई आप लोगों के लिए कि हिंदुस्तान में बहुत 75% एरिया हाइड्रोमेट डिजास्टर से अफेक्टेड है और बहुत सारे जिले या तो ड्रॉट से अफेक्टेड हैं या फ्लड से अफेक्टेड हैं या साइक्लोन से अफेक्टेड हैं. तो एक तो कि बहुत ज्यादा परसेंटेज कंट्री का हाइड्रोमेट डिजास्टर से अफेक्टेड है, और ये कोई आज और कल की बात नहीं बता रहे, ये पिछले 50 साल यानी 5 डिकेड्स का डेटा से ये बताया इन्होंने. और उसमें भी इनकी ये पॉइंट बहुत अच्छी उजागर हुई है कि व्हाट यू हैव सेड दैट व्हाट वाज सीन प्रायर टू 2005 उसके कंपैरिजन में 2005 से 2020 यानी 15 साल में, मतलब आप सोचिए 35 साल के मुकाबले 15 साल में यानी पिछला 15 साल में कहीं ज्यादा इवेंट हुए हैं अगर आप उसको पिछले 35 साल से कंपेयर करते हैं. तो ये मैसेज है कि ये हाइड्रोमेट डिजास्टर्स आर इंक्रीजिंग इन फ्रीक्वेंसी विद द टाइम. So that is the message that they have from their work. और ये भी एक इम्पॉर्टेंट मैसेज है कि जो हमने 3 फैक्टर बताए एक्सपोजर, सेंसिटिविटी एंड अडेप्टिव कैपेसिटी में, तो उनको कोई जोन मिला ही नहीं जिस जोन में हाई अडेप्टिव कैपेसिटी है. अब आप यही समझिए ये जो मैसेज इनका है वो ये बताता है कि अगर कोई भी जोन हाई अडेप्टिव कैपेसिटी बिल्ड करता तो इरेस्पेक्टिव ऑफ द एक्सपोजर एंड सेंसिटिविटी उसकी वल्नरेबिलिटी इंडेक्स बहुत हाई नहीं होती. तो अगर आप अडेप्टिव कैपेसिटी इंक्रीज करते हैं तो आप रिसाइलियंस की ओर बढ़ते हैं. दैट्स एन इम्पॉर्टेंट पॉइंट. एक और इम्पॉर्टेंट पॉइंट जो इनकी स्लाइड में मैंने देखा वो ये है कि इस कंट्री में 1/3 ही डिस्ट्रिक्ट्स के पास, ओनली 1/3 ऑफ द डिस्ट्रिक्ट्स ऑफ द कंट्री 32% ने ही सिर्फ डिस्ट्रिक्ट डिजास्टर मैनेजमेंट प्लान बनाया. इसका मतलब लगभग 2/3 देश के डिस्ट्रिक्ट्स में कोई डिस्ट्रिक्ट डिजास्टर मैनेजमेंट प्लान नहीं है. और हेल्थ सेक्टर का प्लान तो शायद लगभग सभीयों में नहीं है। तो ये एक बहुत बड़ा चैलेंज है आप लोगों को समझने के लिए कि हम आज इसलिए बैठे हैं कि ये साइंटिस्ट अपनी स्टडीज के थ्रू हमारे सामने में रॉ सिचुएशन को प्रस्तुत करते हैं, हमें बताते हैं कि कंट्री का चैलेंज क्या है, और फिर हम उस चैलेंज को समझ सकें और करेक्टिव मेजर्स लें। अगर कंट्री में डिजास्टर डिस्ट्रिक्ट लेवल पे डिजास्टर मैनेजमेंट प्लान नहीं है तो हमें उसमें प्रयास करना आवश्यक है। चलिए, दूसरे सेक्टर्स का प्लान आप लोगों के हाथ में नहीं है, पर जो हेल्थ सेक्टर का प्लान है वो तो आप ही लोगों को बनाना है। तो कम से कम आप उस पर प्रयास करें, और अगर आप उस प्लान को बना के अपने डिस्ट्रिक्ट कलेक्टर मजिस्ट्रेट साहब को भेजते हैं तो देन दे विल अंडरस्टैंड दैट यस, at least health sector has given it, let organize it for the all other sectors and have a complete plan. तो किसी को तो someone has to make an initiative, that's important. अपनी adaptive capacity को increase करें। एक चीज इन्होंने और बताई वो ये है कि 40% डिस्ट्रिक्ट, 40% ऑफ डिस्ट्रिक्ट आर इन शिफ्टिंग पैटर्न। इसका मतलब वहां पहले जहां पे सूखा पड़ता था वहां बाढ़ आती है, जहां पहले बाढ़ आती थी वहां सूखा पड़ता है। तो समय के साथ चीज में बदलाव होता है तो दोनों ही नुकसानदायक, ना सूखा अच्छा है ना बाढ़ का आना। बट वो चैलेंज, जब चेंज का जो नया चैलेंज आता है वो एडमिनिस्ट्रेशन के लिए बहुत बड़ा इश्यू है। तो पहले तो उसकी पहचान जरूरी है कि आप समझें कि ऐसा हो रहा है ना। ये नहीं कि जो चीज हो रही थी वही हो रहा है, ऐसा नहीं हो रहा। The situations are changing, you should recognize the challenge and then make the measures. तो एक ये इन्होंने बात बताई, और जब इन्होंने अपनी आखिरी स्लाइड्स में बताया कि हमसे जब हम इस क्लाइमेट वल्नरेबिलिटी इंडेक्स डील करते हैं तो हमारे को क्या हमारे सामने प्रश्न होता है, क्या है जो हम कर सकते हैं, किस प्रकार इसका इस्तेमाल कर सकते हैं।
डॉक्टर श्रीवास्तव, सॉरी टू इंटरजेक्ट, आई विल जस्ट टेक 10 seconds. हमारे पास कुछ पोल क्वेश्चंस हैं which my colleague Shravan will be just playing it out. By the time you describe it, thank you so much for putting it all together in a much simplified version. Shravan, if you can pull out the poll questions and place them. मैं आप सबको रिक्वेस्ट करूंगा कि प्लीज आप अगर पोल क्वेश्चंस के आंसर दे पाए, एंड इन द मीन टाइम वी कैन कंटिन्यू विद द डिस्कशंस।
ठीक है, तो मैं ये कह रहा था आपको कि जो इन्होंने बातें कहा, उन्होंने पहला एक बात बोली वो ये है कि हम अवेयरनेस जनरेशन करें। हमारे प्रोग्राम का काम है, यही हमारा मैंडेट है स्टेट लेवल पे या डिस्ट्रिक्ट लेवल पर, तो हमें अवेयरनेस जनरेशन पे काम करना। दूसरा इन्होंने कहा कैपेसिटी बिल्डिंग, वो भी हमारे प्रोग्राम का मैंडेट है, तो हमको अपने प्रोग्राम के थ्रू कैपेसिटी बिल्डिंग पे काम करना। तीसरा इन्होंने कहा हेल्थ सेक्टर प्रिपेयर्डनेस कर सकते हैं, वो भी हमारे प्रोग्राम का मैंडेट है, इसलिए हम हेल्थ सेक्टर प्रिपेयर्डनेस के प्रति काम करें। तो ये सारी चीजें जो इन्होंने हमें सजेशंस में बताई, एक्सेप्ट रिसर्च जो प्रोग्राम का मैंडेट है पर अभी हमारा उसमें प्राइमरी फोकस नहीं रहता है, बट ऑल द अदर थिंग्स आर विद इन द मैंडेट ऑफ द प्रोग्राम फ्रॉम डिस्ट्रिक्ट लेवल, स्टेट लेवल टू द नेशनल लेवल, एंड वी शुड मेक एन एफर्ट using the information provided by organizations such as CEEW, and knowing the challenge of our own district by the efforts that has been done by CEEW in this report, and try to make necessary initiative in area of awareness, capacity building and health sector preparedness. That's all that I wanted to say to my program officers, that this will definitely be useful for you. But before I go ahead, मैं एक तो किसी का कोई क्वेश्चन हो
क्वेश्चन
तो मैं एड्रेस करूंगा। इन्होंने एक क्वेश्चन डॉक्टर सक्सेना ने पूछा है, since climate change is an evolving situation and a dynamic over a period of time, how frequently the CVI needs to be revised for different districts? तो इसका प्लीज रिस्पॉन्ड करें आप लोग।
Dr. Saxena, thank you so much. This is a wonderful question. फर्स्ट एंड फॉरमोस्ट क्लाइमेट वल्नरेबिलिटी इंडेक्स जो मैप किया गया है, इट्स अ लॉन्ग टर्म ट्रेंड दैट वी हैव ट्राइड टू कैप्चर एंड एनी लॉन्ग टर्म ट्रेंड वो जो सिचुएशनल एनालिसिस अगर किया जाए तो हमें पता चलेगा कि the kind of analysis holds true at least for 2 to 3 years. But CEEW is developing a climate risk atlas. जिस climate risk atlas में next 5 years and next 10 years में how exactly the evolving risk landscape would be, we are going to capture it. And इसीलिए first step था climate vulnerability index. So हर 2 साल में हमारा प्लान है कि हम climate vulnerability index को अभी रिवाइज करें एंड साथ ही साथ आप लोगों को इंफॉर्मेशन प्रोवाइड कर पाए कि शॉर्ट टर्म टाइम इंटरवल में 5 years 10 years from now कैसे हो पाएगा ये सारे मतलब व्हाट एग्जैक्टली इज द इवॉल्विंग रिस्क लैंडस्केप, वो हम कैप्चर करके आपको ज्यादा रिस्क इन्फॉर्म फ्यूचर डिसीजन मेकिंग के लिए हेल्प कर पाए।
ठीक है। और
there was Dr. Srivastava, there was somebody Dr. Shuhail or somebody who had raised and wanted to ask a question. I had given host rights and और किसी के पास अगर क्वेश्चंस हैं आप चैट बॉक्स में डाल सकते हैं so that we can answer them.
ठीक है। और ऐसा है कि आप लोगों को रिपोर्ट्स के लिंक चैट बॉक्स में दे दिए गए हैं और हम बाद में भी आपको प्रोवाइड करा देंगे। एक बात किन्हीं ने पूछा था कि मैं पहले भी कई बार बोलता आया हूं और आप लोगों को फिर से कह रहा हूं, जो मेरे डिस्ट्रिक्ट के प्रोग्राम ऑफिसर्स हैं, कि हमने प्रोग्राम के अंदर में एक व्हाट्सएप ग्रुप बनाए हुए हैं अलग अलग जोन पे डिस्ट्रिक्ट ऑफिसर्स की। तो प्लीज अपना इंश्योर करें अपने स्टेट ऑफिसर के थ्रू कि वो व्हाट्सएप ग्रुप में आप एनरोल्ड हैं। अगर हैं तो फिर आप वो व्हाट्सएप ग्रुप आपके फोन पे आपको दिखाई दे रहा होगा और उसमें आप एनलिस्टेड दिखाई देंगे। अगर आपके पास वो नहीं दिखता है या आपका नाम उस पर नहीं दिखाई देता है तो ऐसे में अपने स्टेट ऑफिसर को कंसल्ट करें, नहीं तो हमको कंसल्ट करें। एंड द पर्पस इज कि इस व्हाट्सएप ग्रुप के थ्रू हम आपको एट द अर्लीस्ट पॉसिबल हर सेमिनार के बाद जो पीपीटी है, जो लिंक्स हैं और जो वीडियो रिकॉर्डिंग्स हैं उसको आपके भेजते हैं, ताकि अगर आप उसको दोबारा से अपने आप सुनना चाहें या पीपीटी देखना चाहें या रिपोर्ट पढ़ना चाहें तो एंश्योर दैट यू आर अ पार्ट ऑफ इट। ईमेल्स आप भेजते हैं बट यू अंडरस्टैंड प्लीज कि ये पॉसिबल नहीं हो पाता कि इंडिविजुअली हर एक के ईमेल को कोई नोट कर रहा हो, इसलिए वो एक एफर्ट है जो सिर्फ एक प्रोग्राम के नहीं पर every week we have something or the other happening in the program. Please be an active member of the program by being part of the WhatsApp group of your own zone. And मेरी तरफ से एक क्वेश्चन है आप लोगों को, अविनाश और श्रेया जी को, और वो क्वेश्चन ये है कि जो एक इंडियन मेट्रोलॉजिकल डिपार्टमेंट ने एक सीवीआई का एक अपने वेबसाइट के ऊपर में एक मैपिंग की है, how is that different from what you have in your report?
Okay. IMD हमारे डेटा की सोर्सेज जो हैं, ये बेस लेवल डेटा जो है वो IMD और गवर्नमेंट ऑफ इंडिया ने जितने भी इवेंट्स को या तो एक्सट्रीम इवेंट के कैटेगरी में कैटेगराइज किया है तभी जाके हमने कैप्चर किया है। पॉइंट नंबर 1, फर्स्ट थिंग इज एक्सपोजर कैपेसिटी इन टर्म्स ऑफ फ्रीक्वेंसी एंड इंटेंसिटी। नॉर्मली जो फ्रीक्वेंसी को मैप किया जाता है, सॉरी जो एक्सपोजर मैप किया जाता है, दैट इज बेस्ड ऑन फ्रीक्वेंसी। डॉक्टर श्रीवास्तव, सॉरी मैं देख पा रहा हूँ कि पोल क्वेश्चंस में सिर्फ हमारे पास 50-60% पार्टिसिपेशन हो रहा है, whereas we have got almost 60-65 participants in the participants. So मैं अगर रिक्वेस्ट कर पाऊँ सबको कि प्लीज पोल क्वेश्चंस में पार्टिसिपेट करें, that would be really helpful for us to understand how and where the understanding is and the gaps क्या हैं, ताकि हम और थोड़ा बेटर एनसीडीसी के साथ काम कर सकेंगे इन सारे गैप्स को एड्रेस करने के लिए। कमिंग बैक टू योर क्वेश्चन डॉक्टर श्रीवास्तव, वन थिंग इज जो कॉम्प्रिहेंसिव असेसमेंट है, चाहे वो साइक्लोन, फ्लड एंड ड्राउट का हो, इन टर्म्स ऑफ एक्सपोजर, फ्रीक्वेंसी एंड इंटेंसिटी हमने दोनों मैप किया है। सेकेंड चीज ये है कि जो सेंसिटिविटी एनालिसिस है वो हिस्टोरिकल टाइम स्केल में एट डिफरेंट टाइम इंटरवल्स हमने डेटा यूज किया है फ्रॉम नॉट जस्ट फ्रॉम इसरो बट ऑल्सो फ्रॉम नोवा एंड नासा, जिसकी रिजोल्यूशन बहुत ज्यादा अच्छी है। पॉइंट नंबर 2, ये सेंसिटिविटी एनालिसिस जो डिटेल सेंसिटिविटी एनालिसिस है, ये एग्जिस्टिंग आईएमडी का जो सीवीआई पहले रिलीज हुआ था, आईएमडी ने नहीं किया था, मिनिस्ट्री ऑफ हाउस डीएसटी ने किया था वो, तो डिपार्टमेंट ऑफ साइंस एंड टेक्नोलॉजी ने, तो उसमें वो कैप्चर नहीं था। एंड एक्सपोजर उनके यहाँ सिर्फ था कि जो भी डिस्ट्रिक्ट्स हैं सिर्फ एक्सपोज्ड है इन टर्म्स ऑफ फ्रीक्वेंसी, इंटेंसिटी की बात कोई नहीं कर रहा है। इंटेंसिटी मतलब नंबर ऑफ डिस्ट्रिक्ट्स दैट आर अफेक्टेड, वो कैप्चर नहीं किया जा रहा था, या फिर स्क्वायर किलोमीटर ऑफ एरिया विद इन अ डिस्ट्रिक्ट दैट इज बीन इंपैक्टेड, बिकॉज हमने थोड़ा हाई रेजोल्यूशन मैपिंग किया था। थर्ड इज अडैप्टिव कैपेसिटी। अडैप्टिव कैपेसिटी में हमेशा जब कैप्चर किया जाता है वहां पे एडमिनिस्ट्रेटिव कैपेसिटी क्या है एंड वहां पे इंफ्रास्ट्रक्चरल कैपेसिटी क्या है वो ज्यादातर मैप नहीं किया जाता है। एंड हमने कोशिश किया है एक हद तक कि इंफ्रास्ट्रक्चरल एज वेल एज द एडमिनिस्ट्रेटिव द गवर्नमेंट फंक्शनल कैपेसिटी शुड बी कैप्चर्ड, और हमने इसको कैप्चर किया है। तो होलिस्टिकली हमारा जो क्लाइमेट वल्नरेबिलिटी इंडेक्स है ये रिलेटिव इंडेक्स के ऊपर बेस्ड है। इसका मतलब नहीं है कि असम अगर रैंक नंबर 1 है एंड महाराष्ट्र रैंक नंबर 3 है तो महाराष्ट्र का कम है और असम का ज्यादा है। रिलेटिवली अगर देखा जाए बिटवीन असम एंड महाराष्ट्र, असम का थोड़ा ज्यादा है एंड महाराष्ट्र का कम है। सो जब आप लोग इस क्लाइमेट वल्नरेबिलिटी इंडेक्स रिपोर्ट की एनेक्चर्स को देख रहे हैं अपने डिस्ट्रिक्ट के बारे में, तो प्लीज रैंक देख के आप लोग कंफ्यूज मत होइएगा, बिकॉज ये रिलेटिव है। आप ये देखिए कि आपकी एक्सपोजर ज्यादा है या सेंसिटिविटी ज्यादा है। एंड डॉक्टर श्रीवास्तव ने जैसे कहा कि हमारे हाथ में एक्चुअली एक्सपोजर और सेंसिटिविटी को ठीक करने के लिए ज्यादा कुछ है नहीं, एक्चुअली है अडैप्टिव कैपेसिटी को ठीक कर सकते हैं, एंड दैट टू फ्रॉम अ वेरी नीच पर्सपेक्टिव ऑफ हेल्थ सेक्टर। तो इसीलिए हमें आई थिंक वी शुड हैव मोर ऑफ दिस कॉन्वर्सेशन कि हम हेल्थ सेक्टर अडैप्टिव कैपेसिटी को कैसे इंक्रीज कर पाए इन द कमिंग डेज कोलैबोरेटिवली। आई होप आई आंसर्ड योर क्वेश्चन।
एक और आपसे सवाल था कि हाँ, ये सवाल ये था कि जी आपने जिन सेंसिटिविटी और अडैप्टिव फैक्टर्स को अपनी रिपोर्ट में कंसीडर किया है, क्या वो आपके रिपोर्ट्स में वो लिस्टेड हैं?
Yes, obviously everything is listed, even individual sensitivity index, exposure index and adaptive capacity index वो भी listed है हमारे में रिपोर्ट में, ताकि आपको अगर देखना है आपकी डिस्ट्रिक्ट की सेंसिटिविटी क्या है इन टर्म्स ऑफ इंडेक्सिंग, वो भी इंफॉर्मेशन आपको मिलेगी, और आपको एक्सपोजर इंडेक्स भी मिलेगा, अडैप्टिव कैपेसिटी इंडेक्स भी मिलेगा। सारे को जब कंबाइन किया गया है तब जाके सीवीआई बना है। डॉक्टर श्रीवास्तव, एक
क्वेश्चन यहाँ सुरेश राठी जी का आ रहा है
जी,
इसको अगर आप आंसर कर दें प्लीज।
Does climate vulnerability index is applicable to all the districts including hilly, coastal, plain and district? Yes, Dr. Rathi, हमने जब climate vulnerability index की मैपिंग की तब हमने सारे क्लाइमेट जोन, सो इंडिया इज डिवाइडेड इनटू 6 क्लाइमेट जोन्स, और 6 क्लाइमेट जोन्स की माइक्रो क्लाइमेट जोन मैपिंग जो है उसको भी हमने कंसिडर किया है बेस्ड ऑन दैट, बिकॉज 40 डिग्री इन अ हिमालयन इकोसिस्टम is actually a heat wave condition compared to a 50 degree in central India. So ये already हमने capture किया हुआ है in terms of climate zones.
Very nice, very nice. तो अभी हमारे पास एक सुरेश राठी जी ने ये कहा है कि उन्होंने भी एक पेपर पब्लिश किया है जो हीट वल्नरेबिलिटी इंडेक्स के ऊपर इंडिया के 4 शहरों पे बना है। तो good work Rathi ji, and we will go through your work, and any other questions that we have today or before we wind up? Okay, so मैं ये कहना चाहूँगा कि I think thank you very much Mr. Abhishek and Shreya for providing us an opportunity to interact with you and presenting your report to our team, and I'm hopeful that it will be of use to our district and state officers, and I'll request you to share your presentation as well as the recording of these proceedings, as well as your report soft copies, so that I can circulate them for my district and state officers, and so that it is available for them, and that would be nice, I think. एक और क्वेश्चन है प्रियंका गर्ग का, आप जवाब देना चाहेंगे?
Shreya, do you want to go ahead and answer this question?
Hello.
Perfect. Go ahead.
Yeah, Priyanka, to answer your question, I think so adaptation should be in focus. Adaptation और mitigation में basic फर्क ये होता है कि adaptation हम तब करते हैं before the onset of something. We better adapt to it ताकि हम उसका effect होने से पहले ही उसको combat करने के लिए ready रहें. Mitigation तब होता है जब हम उसका effect कम करने के लिए तैयारी करते हैं. So obviously हमारा focus होना चाहिए adaptation, लेकिन mitigation because हमारा इतने सालों से हम लोग इतने ज्यादा एक्सपोज या वल्नरेबल हैं, तो एकदम से अडेप्टेशन को एकदम 0 to 100 लेवल पे लाना आसान नहीं है. तो mitigating efforts are always there. Mitigating efforts should be continuous, but adaptation should actually become the focus for the next 10 to 15 years for India.
If I have to add you, Priyanka, I don't probably I need to understand the premise what you asked in terms of understanding mitigation and adaptation. अगर health sector की बात किया जाए तो adaptation ये है कि अगर आप एक flood prone area में हैं तो आपकी health infrastructure ऐसी होनी चाहिए कि उसके floors inundate ना हो normal rainfall में या फिर flooding situation में. ये हो गई adaptation. But even if और मिटिगेशन ये हो गया कि अगर आप क्लाइमेट चेंज के पर्सपेक्टिव में कहा जाए तो कार्बन एमिशंस कम किया जाए ताकि टेम्परेचर राइज हो ही नहीं कंप्लीटली. सो दैट इज व्हाट. बट मिटिगेशन इन टर्म्स ऑफ अ वेरी इंफ्रास्ट्रक्चरल पर्सपेक्टिव वुड बी कि आप अपने इंफ्रास्ट्रक्चर को, मतलब आपकी जो हॉस्पिटल बिल्डिंग है उसको ऐसा बनाएं ताकि कभी भी उसमें शॉक्स ना आए, वो विथस्टैंड कर पाए. अगर शॉक्स आए भी तो वो विथस्टैंड कर पाए. सो ये भी अलग पर्सपेक्टिव होता है. बट आई एम अज्यूमिंग कि आपने जो ट्रेडिशनल डेफिनेशन है एडेप्टेशन एंड मिटिगेशन का वही पूछा. एंड द टाइम हैज कम जहां पे हमें एडेप्टेशन और मिटिगेशन को दोनों लेंस से नहीं देखना चाहिए, रादर उनको कॉम्प्लीमेंटरिटी में देखना चाहिए सो दैट को बेनिफिट्स को हम इजिली मैप कर पाए.
Okay. So with this, I once again thank you all. Thank you, Avinash, and thank you, Shreya. And thank you to my officers for logging with us. Please continue to participate in as many possible numbers in the seminars that we hold. They have been specially organized to give you an understanding of what are the new perspectives coming up from the scientists who have worked in India in the area of climate change and environment, shortlisting things and reports or publications which may be of interest for you to understand why you are doing things which have been assigned to you under the program, and so that you can do a better service at your own district or state by being better informed about what is new available in the science. With this, thank you for being with us. Thank you. With this,
absolute pleasure, Dr. Srivastava, and it was great meeting all of you. We hope we can continue this discussion and build a health sector resilience. Thank you to one and all. And yes, I would need to thank Dr. Purvi Patel as well, because she has been connecting the dots and doing all the background work in terms of coordinating and making this webinar and this session more interesting. So thank you so much, Dr. Patel. And of course, to the NCDC team and Dr. Srivastava. Thank you.